My name's Miriam Garrett. I'm one of the physical therapists at Kirby Medical Center, and I wanted to talk about urinary incontinence. I am one of the few local physical therapists that works with pelvic floor issues in women, and urinary incontinence affects a large female population. Young people have problems with it, as well as our senior adults and everything in between. So I do want to say that it is not a normal aging process, and there are often treatments that we can minimize your symptoms, or we can totally cure the problem. The three types of urinary incontinence include stress incontinence, which involves weakness of the pelvic floor so that it cannot control the intra-abdominal pressures that increases with coughing and sneezing, or maybe an athletic activity such as running or jumping. Urgency is more of a neurological problem, so its triggers cause leakage, such as listening to water running, or you pull your car in the garage and have to run to the bathroom. The third kind is called mixed incontinence, and it is a combination of stress and urgency. So contributing factors to incontinence could be pregnancy and childbirth, weakness of your core, overtraining for an athletic event can actually cause tightness in the pelvic floor and decrease control. Trauma can cause that problem, and some neurological conditions as well. So a physical therapist role would involve a private patient interview. We would do a general musculoskeletal evaluation that would look at posture and core strength and flexibility. And then if and only if the patient is comfortable, would we do an internal and external pelvic evaluation. Internally, we can best evaluate the strength of the pelvic floor, the flexibility, and also look for pain in some of the soft tissue structures that might be there influencing the leakage. So then treatment options would include education. We would talk about normal bladder function, maybe need to do some bladder retraining, and we would also talk about diet and fluid education and supplements, since that can affect bladder function as well. Exercises would include strength and flexibility, probably core and pelvic floor, depending on what we find in the evaluation. We do have the option of using biofeedback and electrical stimulation if needed, and we try to tie our exercises into daily activities. And as far as follow-up, we would usually see people for 6 to 8 visits, and usually schedule them once a week, maybe once every other week, and so the main focus is the home program. So if you are someone who deals with this, I really hope you'll consider talking to your primary care provider and consider a physical therapy referral so we can evaluate you and see if there's something we can help with.